Hello, good afternoon. Welcome to Measles 101 in 10. Want to wait for those who would like to join us today. I'm going to give them a few minutes to get in and we'll get started. Okay, well, good afternoon. We want to make sure and give everyone an opportunity to join. But my name is Winston Bowie. I'm a senior health education coordinator with the City of Houston Health Department for the Office of Public Health Education. And for today, we're going to be discussing measles, learn a little bit more about some of the current outbreak that's occurring. So we just want to remind everyone, first and foremost, that vaccination is the number one way we can prevent measles spread. We want to make sure everyone does take the opportunity to speak with your doctor. If you're unsure about your current status, if you have received 2 doses of the MMR vaccination, this is the best way to prevent the spread of measles. So we want to make sure that we also understand that there is a current outbreak that's in West Texas. The current numbers that we're showing as of this week is 762 cases since January. And out of those 762 cases, since the start of January, we've had 99 patients who have been hospitalized. And unfortunately, we've also had 2 fatalities that have occurred, and these were children, unfortunately, that were not vaccinated. The vaccination usually it's received during childhood immunizations. So we just again want to remind you to check if you're unsure of your status, and it is 2 doses that you will need to be 97% covered against the spread of measles. If you are going to be doing some summer travel, we do know there are a few weeks left before that time where kids go back to school. We want you to be sure to go ahead and check with your doctor and check your status. Again, it is 2 doses that are needed. Areas that you want to be of concern for travel would be international travel. So if you are planning to do international travel, or if you're doing travel to Gaines County or Lamar County, these are areas that you may have a higher risk of potential exposure to measles. So please be sure to check your status. And if you do need those 2 vaccinations, talk with your healthcare professional about how to get those scheduled. We do want to remind you that measles is a very highly contagious disease, and we just want to make sure you understand that all ages can be affected. A lot of times we hear about this is a childhood immunization, but again, if you're unsure you've received the vaccination or if you've never had the measles, this is a time that you really want to consider and talk with your doctor, see if there is a concern or if you do need to have that vaccination. There are some complications that are very serious that can occur if you do happen to get the measles. So you do need to assess the severity of it by checking with your doctor if you think you've been exposed to it by any chance. And some of these can be life threatening. So let's talk a little bit more about those complications. Those can include respiratory illness, and these can be some conditions such as pneumonia. Pneumonia is one in which, if you are a person that has some underlying health conditions, it can put you at risk for some complications. So, this would be one you definitely want to consider if you haven't received that vaccination and go ahead and put it on your to do list. And we also want to look at one that may not be as recognized, and it's brain swelling. This is called encephalitis. So, brain swelling, it can occur during the infection of measles. But this is one key thing that most people don't recognize is that you may not experience it as soon as you overcome measles. It can last up to 7 to 10 years after overcoming measles that you could have potential brain swelling that's occurring and not even be aware of it. So these are some long lasting effects of measles that we want you to be sure to be aware of. These are some things to take into consideration. And you may say, well, how often does this happen? Well, it's roughly about 1 out of every 1,000 people who do get the measles that they do experience the brain swelling. That may not seem like a lot, but when you think about the number of cases that occur after the couple of years that we've had, we at one point had this disease what we considered to be eradicated, and that was back a few years ago. But now we're in a different situation with the current outbreak that's in Texas, and it is spread to a few other states as well. So we also want to make sure and let you know that when it comes to the other considerations, hospitalization is a consideration, and you have to consider, are you willing or want to be at risk for having to be hospitalized due to complications? One thing is for sure, and this is proven through research through the CDC, that 1 out of every 5 individuals who do not choose to get vaccinated, they will have a risk of being hospitalized due to the complications. And this could also potentially lead to death. So these are some of the complications we want to hopefully avoid. It is a preventable situation as far as the complications that can arise. At least 97% of that time can be prevented through 2 doses of the MMR vaccination. We also want you to understand that a lot of people at this point in time may not be sure of their status. Again, this was considered at one point in time eradicated. At this point in time, it's a little bit of a different situation. So to decrease your risk of infection, best to go ahead and take that opportunity to speak with your doctor. If you do happen to think you've been exposed, some symptoms you want to look out for. Well, roughly 7 to 14 days after initial contact, you will possibly have a fever. Now, some of these may sound like regular symptoms, so be sure to listen to all of these. Fever and cough usually will be the start if you have those. Maybe a runny nose, some watery eyes. This sounds a little bit like seasonal allergies, right? So as you start to look at the rest of these symptoms that occur over the next few days, be sure to watch out for the next steps, which would be roughly 2 weeks after. You may have white spots that would occur inside the mouth. That's not a typical symptom that you would have from your common cold or for seasonal allergies. The white spots inside the mouth you would have to look for. These are some other things that you would experience, which would be a rash. They usually start along the hairline, and it will travel from the hairline all the way downward. Once you start experiencing these symptoms, at that point, recognize that the symptoms may be present, but before those symptoms actually start, 4 days before, up to 4 days after the rash, you can be able to spread measles without even knowing you have it. So that's the problem we are facing with measles, is that it's almost kind of like when we were in a COVID situation a few years ago. You're seeing something that you get days after that you're not even recognizing you're able to still spread. So these are the reasons why we really want you to take every opportunity to get the MMR vaccination, at least 2 doses, to reduce your risk for spread. We also want you to recognize how it's spread. It's spread airborne. The thing that most people don't know, yes, it is something that we have can be, I see a question that's coming through. We're going to answer questions as well. But we want to make sure that the spread, you understand, is through cough and through sneezing, but it can last up to 2 hours in an area that a person that's infected has visited. So I want you to keep that in mind, that areas that you may commonly go, these are areas that if a person's went to and they're no longer even present there once they've left, that 2 hours after that time frame, surfaces that they maybe coughed or sneezed at, whether it be a table they were sitting at, eating, restroom that they went into, anywhere that they visited, it can last up to 2 hours and be present in the airspace in an environment, and you can potentially be infected with it. You may say, well, what's my likelihood of being infected with it? Well, if you're not vaccinated, roughly 9 out of 10 people that are in that airspace will get infected with measles. So it's highly contagious. And again, you may not even know that you are spreading it if you happen to be the person up to 4 days before you even have symptoms. So we want you again to take an opportunity, look, see if you can, your current vaccination status. If you're not aware or you're not certain of it, it won't hurt to get another vaccination if you don't know for sure your vaccination status. Those who lack immunity, we definitely want you to check and see if you can get it. And what would be lack immunity? That you've never had the measles before, or you're unsure of your vaccination status. These are areas in which you want to double check and make sure. Some things to keep in mind, some high risk groups that may be more at risk for measles complications would be those that are infants and children under the age of 5. Also pregnant individuals. And keep in mind that pregnant individuals cannot receive the measles vaccination. You can get it before or after, but not during pregnancy. And people with weakened immune systems also will be high risk for complications. So it's important, anyone who's going to be interacting with a child that's getting ready to be born, for the reason of the fact that they do not have strong enough immune systems before the age of 6 months, that you would need to be vaccinated, because they cannot get vaccinated until at least 6 months of age. And those that would be traveling internationally, we really want to stress the importance of that so you don't potentially expose young children to the measles. I recognize that we're now getting close to our time for 10 minutes, but I want to go ahead and take a look at some of the questions that are here. So, will getting vaccinated during early symptoms stop measles from progressing further? So, this is a really good question that I would say you want to definitely check your status to see if you are potentially already immune to it. And I would say check your status first to see if you received the MMR vaccination. There's been a lot of discussion around this. If you did have potentially back in the day an exposure to it, you would potentially have some, what I say, protection against it. Also, if you had the 2 doses of MMR vaccination, you are going to be covered for life. If you had potentially been living in 1957 around that time, there was an outbreak that pretty much everyone who was alive at that time was exposed to it. So you have what they consider a lifelong protection. So we want you to again not say for sure that you should say, "Hey, I'm for sure at that point I have it." If you have any uncertainty, check with your doctor. It's always going to be wise to go and talk with your doctor to make sure your immune status. And if you have any question about it, again, it's not a harm to go ahead and get another dose of the MMR vaccination. The main thing here is to make sure that you do have protection, especially if you're going to be traveling internationally or going to areas where there's an outbreak. The good news is here in Houston, we've only had 2 cases in which that has happened, and those were international travel. So there's no outbreak that's currently here, and we hopefully want to keep it that way. So some of the best ways you can do that is, again, by getting your MMR vaccination, making sure that you stay abreast of information on sources such as the Houston Health Department or Center for Disease Control, or also Department of State Health Services from Texas. These are the reliable sources you can get most up-to-date information, and you can help spread that information to family and friends. So we want you to stay safe. We thank you again for tuning in for Measles 101 and 10. And thank you again. And we look forward to you having a great summer. Be safe and be able to spread the word on how to stop the spread of measles.